How are you?
Good, how are you?
Good. It's nice to meet you.
Nice to meet
I've
you.
heard very good things about you.
Oh, you too.
Thank you for doing my stranger interview
Of
with me.
course.
So, basically, for this interview, I'm just going to ask you a series of questions regarding compassion with your field of work and life in general. Please do not hesitate to tell me to skip any question that you would feel uncomfortable answering.
Okay.
Before we begin, do I have your permission to record you for this project?
Yes.
Okay, perfect. I want to begin with providing an overview of compassion's definition. That is the overview to the class and what your questions will be tailored towards. Compassion is feeling someone suffering and having the desire to alleviate their pain. With that being said, would you mind just telling me about yourself?
So I have been a nurse for almost 2 years now. I started in a trauma neuro step down. So what we did there was we took care of patients that had strokes, that had TBIs, um, just things like that. And like traumas were people that would fall, and I would have to show up every day for people with those problems and try to be there for them and take care of them by giving them their daily medicine, monitor their vitals, and just be there in case they need to talk about anything as well. Now I'm in the trauma burn ICU, which is a little more intense because it's critical care. So these people are a lot more sick. And then with the traumas, I see a lot of things like gunshot wounds and car accidents. And then I see like the house fires with the burn aspect. Um,
Wow.
yeah. So with that, it's quite a lot, but I try to be there for my patients, mentally, physically, and emotionally, just all around. I try to be there for them. These people go through a lot of trauma and they suffer a lot of injuries, and then they suffer a lot of mental stuff that they have to deal with along the way, like PTSD and stress and anxiety and depression after all of the things they've been through. So I really try to incorporate a lot of compassion into those things.
Yes, that's awesome. What made you want to go into the nursing field? Did you have any specific scenario that influenced you?
My grandma was a big influence on that. She was diagnosed with cancer when I graduated high school. So after that, I kind of struggled a little bit with trying to figure out what I wanted, but then like I changed my major from psychiatry to early education, and then found out about nursing, and I was like, well, maybe I should try that. I feel like I would really like it. And I did a CNA class as well and worked at a nursing home for a little bit. So I did all that. And once I saw my gram go through all of her things with her cancer, I was like, I want to be able to take care of people the way my grandma has been taken care of.
Oh, that's awesome. Do you, with compassion, was that a subject that you learned in nursing school? Did they ever go over that with you
Yeah.
guys? Do you think that was an important topic to learn before becoming a nurse?
Yes, I definitely think anyone that thinks about going into the medical field altogether, even if you want to be like a doctor, or EMT, or a PCT, any of those things, definitely having compassion is the number one thing you should have, like wanting to go into that field.
Going through your clinicals in nursing school, did you find that the nurses that you shadowed were compassionate for their work?
Yeah. Yeah, a lot of them were really compassionate. Some of the older nurses, definitely I feel like they've lost their compassion over time, but I feel like that can happen with like being in the field for so long. But other than that, most of them definitely were compassionate.
Yeah. During all my interviews, I like to weave in kindness and empathy compared to compassion, comparing kindness to simply just being nice, and empathy as feeling another person's emotions, but not exactly wanting to take their suffering away, being compassionate. Have you ever caught yourself doing this at work, feeling bad for a patient situation, but not stepping into their suffering?
We try to do that quite often. Like we'll try to like be there for our patients and be compassionate and be there for them. But like with what you're asking, I think, are you asking like, do I take that stuff home with me?
Yeah, kind of. Like,
Yeah.
are you able to like step into their pain instead of just like as a nurse, like as your job, if that makes sense? Like just doing it, how like a routine for you?
Yeah, we try to like step into their pain with them, but once we leave, we try not to take those things home because it can definitely take a toll on you if you try to take work home with you. Or not even try if you just like think about it constantly. But with our patients, we try to be there all around, even if it's not like something that deals with their injury, if it's dealing with something that's like back home. Like if they can't go back to their house because of the house fire, then we need to try to get them placement or get them a home, set up a GoFundMe, things like that. We'll try to do too.
Yeah. Would you say that being in the burn ICU unit compared to other specialties, would you say that you have to be more compassionate?
I would say yeah, just because burns are a whole different realm. Like the pain is no other than other patient pain. The dressing changes can be very difficult for these patients. They have to go um into the OR a lot and they have to get grafted a lot and they get excisions and all the things. And then if they do lose their home or if they lose a loved one in the fire, then we have to be there for them all around, not just physically, like mentally as well. We have to find them psychiatry, we get them involved, and we get like social work involved to try and get them a safe place to go to after.
Okay. Would you say that you had any struggles going from a nursing student to a registered nurse after graduating?
Um, I had a little bit of struggles, just because it like in nursing, like nursing school does prepare you pretty well for things, like communication and your medications you need to know and all your pathophysiology, anatomy and stuff. Like I was good in that sense, but like actually doing it just takes some time to get used to and it takes some time to critically think about things and know what to look out for in your patients.
Yeah. Did your coworkers show you compassion as you were learning everything, bridging it from the classroom to the hospital?
Yes, my coworkers were so helpful. They were always there for me if I needed help with anything, if I didn't know something, if I didn't know like a certain skill or procedure or medication. They were always there to help me and assist me.
Oh, good. Nurses that you said you worked with
Yes.
showed less compassion. Do you think that's just because of burnout with how fast paced everything is in the hospital with going through a routine
I
for so
do
long?
think a lot of like the older nurses can experience burnout, and because of that, they show some less compassion. I've noticed it myself a bit sometimes. Like some days I'll have some harder days and I'll show less compassion. And it's not anything that I'm trying to necessarily do on purpose. It's just something that I feel like can come with time as it's taking a toll on you. But that's where you have to remember that you need to like also take care of yourself and get the psychiatric help you would need and like physical stuff like working out and finding hobbies you like to do and doing things that make you happy on your day off, that way you aren't losing that compassion for those
Yeah.
people.
Definitely. Do you think that it can be hard for some people to take the extra step to be compassionate, especially since in healthcare there's always something going on or another patient to see with always being so fast paced?
That is very true. I do feel like sometimes, not like harking on doctors, but I feel like doctors lack compassion sometimes just because they don't have necessarily like that bedside experience that we do.
Right.
And they're just used to like, treating the patient, treating what whatever disease process they have going on or traumatic injury they have, and then going to the next one and going to the next one. So I feel like there is some gaps that could be improved, of course, but overall, I feel like everyone is there for a reason. Everyone wants to work in healthcare for a reason and has some sort of compassion there. It's just that they don't show it as well.
Yeah, definitely. I made a poster a couple weeks ago for our class project, but it was on the polymorphisms of oxytocin and how people are naturally born genetically to be more compassionate than others. Do you think that that's something that's true, where some people are just naturally more compassionate compared to
That's
others, or do you think it's learned?
That's pretty cool. I didn't know about that, so that's something I learned. But I can see that there are some people that grow up more compassionate than others. Like myself, I've always been the type that would give you the shirt off my back if that's all I had and you had nothing. And a lot of my family members are like that too. And then there's like other people you meet that grow up in different environments. So I feel like a lot of it can be like genetic, like you're talking about, but it also could be learned from how you've grown up and like your environment and things like that.
Yeah, so you would say that you grew up in a compassionate home.
Oh,
Do you
yeah.
have someone that was most compassionate towards you growing up?
My grandma, as another example, she was always very compassionate. She would help me all the time, like, especially throughout college. She was always there for me and she would always make sure I had food, make sure I had money, made sure I had gas to be able to go to class. And she was always there to talk to me if I needed to about things that were hard on me.
Oh, that's awesome. My classmates, so they also did a presentation. We have a compassions book that we read, so we pretty much like cut up chapters and then we each have our own to do, but theirs was on compassion in the healthcare field and how it's so fast paced that it leads to burnout after time, like how you were saying with the nurses that you worked with, which leads them in management to have less compassion for themselves than others. How do you show compassion to patients who have strong personalities or family members that come in to visit?
I try to show compassion by um, always being nice to the patients, of course, and always introducing myself and telling them, like, straight off the bat, if they need anything, I'm here for them. I'm going to check on them quite frequently. And then I always ask them questions about themselves, like where they're from, if they have any kids. If they have things that they like to do, especially with our burn patients, like going through dressing changes can be very hard on them and very painful, very mentally and physically taxing. So, what I like to do as one little thing that some people don't really think about is I'll like play their favorite music for them as we're doing it, or I'll like tell them to think of a happy place, and then we'll like go over things like that, and we'll talk about things that actually they want to talk about and not just things that I want to talk about, and
Oh,
things like that.
I love that. So, do you develop, are they in your unit for a pretty long time with the burns? You develop relationships with them while they're in there?
We definitely build a strong rapport with our patients. We actually just had a 24-year-old who passed away, but he was a core donor. He got his liver donated to someone and two kidneys donated to someone. So that was very nice that although we couldn't save him, he was able to save a couple other people. But he had burns pretty much everywhere and they were not healing, and he just wasn't doing very great. He was on pressors the whole time. And when he ended up passing away, we had a walk for him. And it was very hard on like our entire unit because he was with us for 2 months.
Oh my gosh.
But we'll have people for like a couple months, which is quite a long time in an ICU. So
Yeah. With everything that you go through too, being in the unit, how do you pour compassion back into yourself after giving it to other patients like that?
what I like to do personally is I play with my two dogs. I hang out with my boyfriend. We like to go on dates and like little things like take the dogs on walks because he's also in healthcare, so he can see quite a bit too.
Okay.
And then I like to work out. I like to read, journaling. I like to read the Bible, and stuff like just little things that make me happy that will help me get through.
Yeah, that's awesome. I know you said you hang out with your boyfriend. Do you rely on anybody else too to be compassionate towards you to fill up your cup as well?
I definitely lean on my family a lot and my friends. My friends and I will do things together too. A lot of my friends are also nurses, which is helpful because they
Okay.
understand the things that I'm feeling and going through, and they'll talk about what they have seen and how they feel as well. So that's pretty nice. We all get to talk about that, and we like to do things outside of work that help us just, like you said, fill up your cup and feel better about
Yeah, that's awesome. As someone who is going to be applying to nursing school, what advice would you give to me and other students entering the healthcare profession?
I would say always be up to learning things because you're going to learn every single day. There's some people you'll meet that feel like that act like they know everything sometimes, but you don't know everything. Like there is so much health out there and so many things that are still being discovered today, and still things that are getting readjusted with things, and a lot of evidence out there that's still being found out. So definitely always be up to new challenges, always be up to learning new skills. Um, I would always lean on some people, lean on your higher up nurses that have been there and have the experience because they will be the ones to help you get through. Never lose the compassion as we're talking about. Don't lose that, and take care of yourself because you need to take care of yourself before you take care of others. Um,
Definitely.
yeah.
Okay. Well, that was my last question for you. Do you have any questions for me or anything else that you would like to add?
No, I don't think so.
Okay. Well, thank you so much again for being a part of my interview.
Of course.
You are a very admirable nurse, and I'm glad I got to meet you virtually and learn more about you. And hopefully, we can meet in person
In
someday.
person, yes. I
Yes.
can't wait.
Yes.
We'll have
Thank
to like
you.
do a double date or something.
Yeah, definitely. Thank you so much.
You're welcome.